This segment is sponsored by Children's Hospital of Richmond at VCU.
The doctor is in and you have questions. Whether we want to believe it or not, summer is winding down. And if you're preparing for the start of a new school year, you certainly have some questions, especially as we face another year with COVID considerations. Dr. Bergen Nelson is a pediatrician with Children's Hospital of Richmond at VCU and a former teacher and mom of 2 school-aged kids. She's here to address some of the common concerns that families are having. Dr. Nelson, it's great to see you.
Thank you so much for having me.
It's absolutely our pleasure. Let's get right to it because we do have so many questions. How safe is it for kids to be going back into the classroom this fall?
Well, I think for most kids who are healthy, being in school has so many benefits emotionally and academically. I know I'm really excited for my own kids and my patients to go back, so I am so happy that we can, for the most part, be open full-time in person with the proper safety precautions in place.
As we mentioned, those COVID considerations, can you talk us through how this year is going to be the same or certainly different than what most folks experienced last year?
Well, unfortunately, the COVID-19 pandemic is not over, and we are in the midst of a new surge with this Delta variant. So if you had asked me a few months ago, I might have said we really hope to get back to normal. But I really think now we need to be as safe as possible to make sure we prioritize kids getting back in person, but everyone's staying safe, the students, their families, and the staff at the school all being safe. And so it's really important to follow some safety precautions.
One of those safety considerations and safety precautions certainly centers around masks. What are the recommendations and rules right now with schools?
So the CDC, as well as the American Academy of Pediatrics, has recommended universal mask wearing for all people in the school building, regardless of vaccination status. We know that masks are very effective at preventing transmission of COVID-19 and other viruses. And to my mind, they're a fairly minor inconvenience. Most kids do very well with them.
Dr. Nelson, most young people, students, haven't been back in a classroom or even a school building for that matter in quite some time. What are you sharing with families who are sending students back into school in person this year?
Yeah, so for some families, a year and a half of being virtual or out of school, the transition may feel a little bit more anxious this year. We might have a little bit more anxiety on the part of children and families, but I think that keeping those lines of communication wide open with the schools and with your child is really important. So preparing well in advance, making sure you have everything you need. If you can, go with your child to the school building to see the building, meet the teacher and all of that. And then once school has started, the teacher is really a wonderful person to get a sense of how your child is adjusting. And so keeping those lines of communication open with the school is really important.
As a mother of 2 school-aged children also, I think that's a great nugget of advice. Familiarize yourself, if you're able to, with the school and certainly with the teacher. Most families are considering so many things as they head back into the classroom. What's your #1 tip for keeping families safe and as healthy as possible this school year?
Yeah, so we unfortunately are going to have to do all of the same safety things that we did last year. So daily temperature checks and symptom checks, not go to school if you have a fever of 100.4 or higher, if you're feeling any kind of signs of illness, sore throat, headache, body aches, cough, shortness of breath, any of those things, you should seek medical attention, not go to school. Consider getting tested for COVID-19. When you are in school, hand hygiene is really important for everyone, for all of the kids and all of the staff. And then finally, wearing that mask universally, regardless of vaccination status. And then I will say anyone who can get vaccinated should get vaccinated. That's the best way we have to prevent further transmission.
Dr. Bergen Nelson, thank you so much for your time. We appreciate you.
My pleasure. Thank you so much.
Yes. For more information about Children's Hospital of Richmond at VCU, visit chrichmond.org or call 804-828-CHOR. That's 804-828-2467. Stay with us. There's still much more Virginia This Morning coming up after this.